Poso maoni wiak, waiwanan kitanan ni mua e yoski piataya posnotaman e yum MITW Podcast. A yospis piataya posnapi notaman e ne hisikimaka e yoso matnamin e hakihi.
Welcome to the Menominee Indian Tribe of Wisconsin podcast. I'm your host, Sheena Wapus. On this episode, we are joined by Vaughn Bowles, Public Information Officer for the Menominee Indian Tribe of Wisconsin. I would like to remind people that we request you send in your COVID-19 related questions to us at podcast@mitw.org. And then we'd also like to let everyone know that if you're a tribal member or a descendant or a county resident over the age of 18, you can call and make an appointment with Community Health to get vaccinated. So the number for that is 715-799-5430 or 715-799-5769. Welcome, Vaughn.
Thanks, Sheena.
So can you go over the CDC guidelines that were released for fully vaccinated people?
Yeah, so the CDC released some new guidelines this week, which are good news for individuals that are fully vaccinated. Now, fully vaccinated means you have at least 2 doses of the Pfizer or the Moderna vaccine, and it's been 2 weeks, or you've gotten 1 dose of Johnson & Johnson, and it's 2 weeks past that initial vaccination. Now, some of the things they're talking about, these are specifically guidelines for non-healthcare settings, so, us running around in our everyday lives. And they say that we can visit other fully vaccinated people indoors without masks or physical distancing. Now, that's the big thing and what everyone is pretty excited about. In addition to that, they also say that you can visit with unvaccinated people from a single household who are low risk of severe COVID disease indoors without a mask or physical distancing. So people low risk, obviously younger individuals, those without chronic health conditions, or those who aren't immunocompromised. That's who they lump into that group usually. They also say you can refrain from quarantine and testing following known exposure if asymptomatic. So that's kind of a big thing too. On the flip side, they say, however, you want to take precautions while you're in public and wear a well-fitted mask and physical distancing. So not much change as far as going out and doing activities. They also say wear a mask and practice physical distancing when you're going to visit unvaccinated individuals that are at an increased risk for severe COVID. Again, the elderly, immunocompromised. They also want you to wear a mask and maintain distance to other people if they're unvaccinated, and they're going to be individuals from multiple households. That just limits the amount of exposure that could take place at that gathering. And they also want you to check on CDC and health department travel requirements if you're going to go out of state, go out of country. If you want the full list of recommendations, we can put those in the show notes for you.
So you said that after 2 weeks, you're considered fully vaccinated.
Correct. 2 weeks after the second dose, 2 weeks after the second dose of a Moderna or Pfizer vaccine, or 2 weeks after one of the Johnson & Johnson vaccines. Correct.
So with these kind of more relaxed guidelines, is there a limit on the number of people that can be in a gathering?
They're still calling small gatherings like 10 or less. They do say, use your interpretation, be judicious about it, essentially. So just take that into consideration about who will be there in that small gathering. If, there might be some slightly higher risk people, you might want to keep the group smaller. If everyone is pretty healthy, young, and, not at risk or low exposure risk, maybe you can have a few more. But 10 is kind of their go-to number for that.
So is it now safe for fully vaccinated grandparents to visit their grandchildren without social distancing?
It's definitely safer. Safer is probably the best way to say it at this point, because children, even though they don't experience the virus as heavily as older individuals, they're still potential vectors for, infecting, their older grandparents and stuff, even if they are fully vaccinated, because as great as the vaccines are, they're not a 100% done deal for keeping you protected. So you're safer.
So you kind of touched on this, but do fully vaccinated people still have to quarantine themselves if they've been in close contact with someone who's confirmed to have COVID?
I've actually seen both sides of it. The recommendations mentioned above say no, they don't have to quarantine. For precautions, though, on other recommendations, they are asking people to be quarantined until they can get tested and get test results back. We are definitely asking that if you have been contacted by a community health member, warned of potential exposure and stuff, we would like that. We may change that in the future. So we'll be updating you as far as how that goes as we move forward with our vaccination rollout.
It's kind of related, but kind of off topic, but I have an off the cuff question.
Go for it. Those are the best ones.
Okay, so you have someone who's been exposed to COVID and they get tested.
Okay.
Do they still have to isolate after they've been tested?
It depends. So if they've been vaccinated, they don't worry as much about that. If not, they'd still like them to stay isolated until test results are back and they can determine whether it's a positive or negative case. So I hesitate to give a definitive answer on that one. So I'm going to give it depends. And
I feel like all my off the cuff questions get that.
Sorry. I'm sorry. That's the typical answer. I was actually talking to my wife last night. I was like, this is so challenging some days because you're seeing science in action right now, and science in motion isn't always pretty because there aren't always a lot of hard and fast answers to give people. So
sure. No, I understand. Okay. So how much of the community will have been vaccinated after this week?
The last report I received said we'd given out 3,600 doses or so, a little bit more than that. And about a quarter of those have received their second dose already. So a lot of the individuals that were in, the 1A group, all of our essential workers that were healthcare workers and EMS, most of them have received their second dose already. So those people are considered fully protected at this point. And we're working on making sure everyone else in the community can get the vaccines as well.
So can you talk about the wait list for spouses? That information was sent out, I believe, yesterday.
Yeah, we started the wait list for spouses this week. I'll just give you the highlights. If you're a MITW or county employee who has a spouse that would like to get vaccinated and live within a 20-minute radius of the clinic or over 18, you can call up the clinic. It's the numbers we provided earlier, and you can get your spouse on a wait list. They don't have to be tribally affiliated at all. That's been a big question so far. And so you can email Ron Bowen at ronb@mtclinic.net. He can help schedule that, or you can give him a call on that number we gave him earlier. What they're doing is they've found that when they're using the vials vaccine, sometimes they have, and this is just manufacturing bugs and quirks, they'll have maybe enough for 1 to up to 11 extra doses sometimes. And so they'll take those extra doses, they'll call the people on the wait list and they say, hey, we got a dose if you want to come in, and you can go in and be vaccinated.
So will the guidelines for the tribe change as our population is reaching higher levels of vaccination?
Yeah. Oh, hang on. Can I go back really quick? One thing I forgot to mention. So, ways or reasons you can't be vaccinated and stuff. If you've had any other type of vaccination in the last 14 days, shouldn't get the COVID vaccine. Also, if you've had COVID and you haven't been through at least 10 days of isolation, don't get the vaccine. If you've had COVID and been treated with convalescent plasma or monoclonal antibodies, you got to wait 90 days before vaccination. And if you can't wait 15 to 30 minutes for monitoring afterwards, don't come, because there is a waiting period and stuff that they have to make sure that you're not having any sort of reaction after administering it. And they also ask that you don't bring children to the vaccine clinic at this point.
Has that been an issue? People not wanting to wait?
Yeah, some of them are just like, all right, I gotta go. I've got the vaccine. I've got to go. And so there have been some issues, not in our community, fortunately, but across the country, there have been, allergic reactions to the vaccine. And so that's why the weight limit is there. And you're observed by members of EMS and, the clinic to make sure you don't have any of those reactions. All right. Tribal guidelines. You were asking about that too. Yeah, eventually we're hoping once we reach that herd immunity level of 80 to 90% of the population being vaccinated, we hope to have a low enough case burden at that point to just open all of the offices to 100% capacity again. So that's something we're still watching.
Is there anything else that you want to add before we close out the episode?
You know what? We just want to encourage everyone to get vaccinated. If you have a friend or a loved one who's over the age of 18 and hasn't been vaccinated yet, and falls into any of the qualifying parameters, we recommend that you guys contact the clinic and get vaccinated, or just walk in today and get vaccinated, because it only keeps you and your family safer if you have that vaccination and those antibodies built up in your system. Vaccine, when I got it, shoulder was a little sore, but that's way better than being laid up for like 3 weeks sick. And it's way better than any sort of the internal scarring of your lungs that can occur with COVID that they've seen. And it's pretty common. So we recommend getting vaccinated and staying safe.
Thank you, Vaughn. Waiwanan for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-nsn.gov under the Community tab. Keep up to date by following us on Facebook at MITW Podcast. We do weekly updates with Vaughn, and we welcome any community questions that you have regarding COVID-19, so please send those to us via email at podcast@mitw.org.